So what we're going to do now is we're going to talk to Molly after the explantation, but I'm also going to backtrack and ask her some questions about her experience. So Molly, I know you're ticklish. I know,
Right.
yeah. I mean, she is so ticklish that if I even approach her foot, you know, and she's not acting, she doesn't want me touching it. Would you briefly explain your experience with the screw and explain all the activities that you you pursued after implantation? So we want to talk first before we talk about your experience, recent experience with explantation. What did you do during the implantation process after you healed? And I take it was about a month after or 3 weeks after?
It was about 5 weeks that we stayed home, and I was grounded and well behaved. And then we went to Pennsylvania and we painted our granddaughter's bedroom. And then we drove back home to St. Louis, and then we went to Colorado, drove to Colorado and spent 2 weeks out there. And there I was trying to work on getting back on the bike in the exercise room and walking a little bit outside in that beautiful nature. And I think by the end of the 2 weeks I was walking about a mile. And so I was pleased with that. And then we came home and we had about a week, and then we left home for 4.5 weeks, and we went on 2 cruises, and we also went to Europe and walked all over Europe visiting exchange students. And then
how many miles were you doing in Europe a day? And about how long after the procedure, or during the implant, after the implant of the screws, how long was it? And how many miles did you walk in Europe average a day?
What would you say, hon, for the mileage? I'm lousy on that.
Easily 4 miles a day,
4
I'd
miles
say.
a day.
Maybe
City walking, concrete, and
because we were doing tours in Helsinki and Tallinn, Estonia, and that was kind of a forced march. We almost missed the ferry in Tallinn.
Yeah.
And we really hoofed it at high speed, at least 2 miles from the center of Tallinn, Old Town, to the ferry.
Yeah.
And that was a forced march, and she did well.
So yeah, so
the story's not done yet.
Yeah. So,
Okay.
so and then we did come home, transatlantic crossing, and we were home about a week, and then there was a call out for disaster relief down in North Carolina from Hurricane Matthew that came in and parked over there. So we went with our Southern Baptist team and went down and did 5 days of heavy labor down there, pulling out wet stuff from homes, walls and insulation, and pulling out flooring and such. So, and then after a week of doing that, then we came home, and we have stayed put since.
And most of your activities were done in tennis shoes.
Yes, right, and flip-flops too. Until we got to Scandinavia, it was too chilly to wear them. So.
Okay, I'm going to take the camera and I'm just going to take a quick peek at. By the way, this is her husband right here, who was with her the whole time.
Yes,
So,
yes.
this is her foot right now. She's got a little bruising from the explantation, which can be normal, and we see 2 small incisions. We see the incision with a single stitch over where the Austin bunionectomy was performed, and a single stitch incision where the Aiken osteotomy screw was removed. So now you've had the screws removed. How's the experience been since removal?
Oh, fine. It's like each day it's better, it's easier, and yeah. And the pain, it was like no pain. I've been on anti-inflammatories, and it was from my regular doctor, and it was absolutely sufficient.
Okay, so today we're gonna attempt to remove her sutures. I'm going to have to trick her because she's so ticklish.
Right.
And we mentioned the fact that she's ticklish simply because of the fact that she's a perfect person to talk about her experience because she is so sensitive. So this is a good result. She's got a minimum amount of swelling, and she's going to be back in tennis shoes before she knows it, doing activities again. Okay.